EMG Solutions provides electrodiagnostic testing services to provide high-quality data related to the neuromuscular system to physicians to aid in their diagnosis. The first thing that I want to do is make sure that they're comfortable coming into the room. We're going to do some testing today to make sure that the connections are in place so that when you're trying to feel something, we want to know why. And we'll jump into a history and background. I want to know what brought them to this point. But I like to hear the patient. I want to hear the patient tell me what's going on. I want to hear the patient talk to me about their symptoms. I want to ask questions about the symptoms and the progression of the symptoms so that I've got a better picture about what brought us to be here today. In general, we're going to check the muscles to make sure that, are they firing correctly? What kind of strength does the person have? What do the reflexes look like? So I'm going to go through this process of trying to figure out what is going on with that individual. The first part of the exam, we're going to focus on whether or not the nerve is conducting correctly. We call that the nerve conduction study. And what I'm going to do is stimulate the nerve, and then I'm going to record the response. On the nerve conduction study, we're actually looking on the screen at a waveform that pops up. And so if we stimulate here and record right here, as soon as I get the recording over here, I'll be able to look at the screen and see what that waveform looks like. And I'm looking for a change in the continuity. And we want to find out, does the signal stay good and healthy at every point, or do I see a change in that response? And that'll help us identify if there happens to be a problem with the nerve and its interaction with the muscle. We'll be able to identify that. Once we've completed the nerve conduction study, then we'll take an electrode. It looks like a small needle. We'll take that electrode and just ease it into the muscle. And we're careful, we're efficient, but we also work at the same pace that the patient's able to tolerate. So if they're doing fine, we'll move a little faster. If they're struggling, we'll slow down. We've got to get that needle in the muscle and find out what is the muscle doing. And we're looking at these waveforms. The waveforms tell an incredible story. Is the muscle healthy? Did the nerve get there? And is the muscle responding to the nerve? That'll yield a lot of information about the health of the nerve. I'm going to go back through the data, make sure I've got a real clean report together. I'll get this into the system. Your physician's going to have the full report. You'll be able to sit down with the doctor at that point and be able to talk about the next steps for your care.